Hey, this is Different Careers with Kate Nudd. So again, we're going over massage therapy principles and practice, but we're doing case studies and critical thinking, chapters 6 through 10 for this video. So let's get started. So chapter 6 goes over the effects of massage therapy. So a bunch of different stuff. And yeah, it takes a bit to get to the end. Okay, so case study. SOS case. For the past few months, Adrienne has been having a variety of health problems. Her physician referred her to Jeremy in hopes massage would help her relax while waiting for test results. Adrienne explains to Jeremy that she has had pain in her neck, her shoulders, and her lower back. She sometimes feels a light-headed. Her blood pressure is slightly elevated, but she is not taking medication. She has had digestive issues ranging from pain in her upper abdomen after eating to constipation and diarrhea. Sometimes after she eats, she feels short of breath. She also suspects plantar fasciitis because her feet hurt in the morning, and perhaps carpal tunnel syndrome because her wrist hurts and she feels tingling in her fingers. During his assessment, Jeremy learns that Adrienne works as an administrative assistant, sitting at a desk for at 8 hours a day plus an hour commute in either direction. Her hobby is sewing, so she spends a lot of time at a sewing machine. She gets regular exercise, but with her recent pain and digestive issues, she is less active. Jeremy also notes significant forward head posture. Adrienne's neck is rotated left and laterally flexed to the right. She has a considerable kyphotic curve, wrong curvature of the spine. Which techniques are best for Christine? Are there any cautions or contraindications to consider when formulating Adrienne's treatment plan? Should Jeremy wait for Adrienne's physician to make a diagnosis before proceeding? Why or why not? So, as a licensed massage therapist, this person definitely needs to see a chiropractor. And you're probably going to need to massage the problem areas longer. So that means the front side of the neck, and like to help free up the shoulder and stuff. That means working the upper chest muscles, not massaging breasts at all. It also means the back side of the neck, the base of the skull, obviously trapezius, the like whole shoulder. So you might even need to include a deltoid, like the upper arm. Definitely go to a chiropractor. Also, if she's having digestive issues, it's like, well, if all of a sudden you get diarrhea, can you really get a massage? Because if it comes on all of a sudden, that means you're gonna possibly poop on the massage table. So to be honest, I would probably decline this client because it's like one thing to have plantar fasciitis, but if you can't hold it long enough to receive a massage, then it's like, I'm sorry, like you really need to stay home and be in bed. And how do you commute to work? I mean, do you really expect a client to wear like an adult diaper for a massage? I mean that's another way to get around it. And then they probably would need an abdominal massage, but it's like if she's waiting for test results of like what's going on, she could be in dire straits. It's like, I'm sorry, it seems like a contraindication of like, we don't know what's going on with you at the time. I don't think I should see you as a client until you get your full test results back. Because the way they're describing her health conditions is she could have real serious problems going on internally in her body, and she's going to work anyways. Like, I'm sorry. Go home, rest. She should be getting excused absences from work because she has serious medical conditions. Like, that's the way this reads. So I don't know why they're recommending a massage. So it'd be like, okay, you need to stay in the hospital is the way it reads more. And they're just gonna send her home. Like, I don't think so. Like, you need to find out why she's having these abdominal pains and then diarrhea all of a sudden. Why is her neck out of whack? So if anything, like, the hospital should have a chiropractor and a massage therapist on staff to be like, okay, this patient is can you like soothe the digestive system and massage her abdominals a little bit to get circulation flowing? It's like the hospital should be dealing with this, not a spa setting for a massage therapist or a private practice licensed massage therapist. The hospital should have their own chiropractors and massage therapists on staff. And it's like, well, I'm sorry, while you're waiting for the test results, don't you want to make sure that the person, the results of the test the root issue of why they're sick before you recommend getting a massage or a chiropractic adjustment or something, because you want to make sure the person doesn't have a fracture or like a broken like vertebrae or something. So it's like, what are they doing? Like, so I don't think a massage therapist would see this client until the test results are legitimately in and the person actually knows what disease they actually have. Okay, does the gait control theory address acute or chronic pain? Explain your answer. Okay, now we gotta go back in the chapter, gait control theory. I don't know. Gait control theory. Okay, I'm not seeing it, so okay, maybe they didn't cover it in this chapter. Moving on to chapter 7. Anyways, body mechanics, client positioning, and draping. Okay, case study for chapter 7. The Bachelorette. For the most part, Nikki sees clients with sports-related injuries, so she spends most of her treatment time working on specific structure or area of the body. She spends most of the session seated. Not only does this spare her a bit of energy, but she's found that sitting sharpens her focus. Today is a very busy day for Nikki. In addition to a 5-hour sessions with athletes, Nikki's sister hired her to provide Swedish massage for her 3 bridesmaids. Nikki, her sister's maid of honor, was given a gift certificate to receive a massage from her preferred therapist at a later date. After the massages today, the bachelorette party begins. The bridal party will meet their other girlfriends for dinner and then dancing. The wedding is next weekend, and Nikki and her sister have both taken the week off to prepare for the event. Huh? The wedding party arrived at the designated time, and the women spent a little while talking and laughing before starting the treatments. About 15 minutes into this first Swedish massage, Nikki noticed that she was having a difficult time controlling her pressure. The client didn't complain, but Nikki realized that she was using her whole body to try to keep herself from using too much strength, and it was causing discomfort in her upper back and neck. By the middle of the second session, she began feeling discomfort in her lower back as well. She remembered to adjust her posture to a lunge, but found that she'd fall out of that posture without even noticing until she felt pain in her back again. Nikki realized how long it had been since she'd practiced Swedish massage. Okay, case can study continue. Discuss how the table height that Nikki uses when sitting while working might be different from the table height that is more appropriate for Swedish massage. Discuss the importance of proper table height for maintaining control of strength and pressure. Does performing shorter sessions impact the choices a therapist might make about table height and other aspects of proper body mechanics? What suggestions for proper body mechanics might Nikki have used during these sessions to minimize the stress she was feeling? Should she interrupt the massage to make adjustments or just wait for the next session? What can Nikki do after the sessions to keep the aches she's feeling now from affecting her sister's party? Keep in mind that she will be sitting in a car, then at a dinner table, followed by dancing. Discuss how Nikki's preference for the seated posture when doing focused work might be beneficial to both herself and her client. Okay. Well, that is the problem with sports massage. It's not actually specifying how long each sports massage is. Is this a 30-minute session? Is it a 45-minute session? Is it a 20-minute session? Is it a 25-minute session? Because that makes a difference when this information is like, you have 5 clients that you see a sports massage and then you're doing a Swedish massage later. Are these 10-minute sports massage sessions? Like you're lacking important information. So as like the actual time that the sports sessions are going on, because if you do 30 minutes, you have like 15 minutes in between clients. Okay, so let's see, 30, 1 hour, 2 hour, 3 hour, 4 hour. You could actually see like approximately 8 clients in a 6-hour window. Or if you really do need at least 15 minutes in between. So you can see more clients possibly if you have like 30-minute sports massage sessions. But it's like you're doing 5. I don't know. It's just, there's not enough information to really answer these questions. Anyways, if you're seeing 5 30-minute sessions and then you have 15 minutes in between, that's like 2.5 hours of manual labor for massage. And like people try to crunch their time together, and they probably would give themselves 10 minutes in between clients. So you're kind of pushing it. So that's like 2.5 hours, or 2 hour, 2 hours and a half, and then you have a massage later. And then that's 3 people, and then they're saying 3 Swedish massages. Well, how long are these Swedish massages? Are you just doing a half an hour or something? Like, because I thought like a full body needed at least like 50 minutes to 60 minutes. So like that's 3 hours there. Like I'm confused. Like they're not calculating the time properly, basically. Okay, anyways, critical thinking. Why are bolsters needed for client comfort during a massage when most people sleep each night without any cushion but a head pillow? Basically, it's more so when you're face down because your face is in a face cradle, and then that means your ankles aren't in a scooted position off the table, so it's like it elevates the ankles up off the table, and then your ankles are comfortable. So if you're like face up, then you have the option, if it's more comfortable, not to have a pillow or a bolster under your knees. And sometimes I did that when I was receiving massages personally myself. So that answers that question. Okay, chapter 8, massage techniques, joint mobilizations, and stretches. So yes, you can assist with stretching when you are a licensed massage therapist. It is in the scope of practice. Continuing on to the case study. Well, and then you get to see some of the pictures too, right? So some chapters are longer than others. Okay, case study. More than just an accident. Margaret was a recent graduate from the Gulf Coast School of Massage. She acquired her state license and began her practice at a well-established chiropractic clinic. Margaret massaged the physician's patients before their spinal adjustments. The patients loved the massage, and the physicians loved the patients, reported improving more quickly with the addition of the massage before the spinal adjustments. Mark was Margaret's next client. It was Mark's first massage at the clinic. He was a car sales associate uptown and was recently involved in a minor car accident. Mark's chiropractor gave clearance for him to begin receiving massages because Margaret was asked to address his back, neck, and shoulder only. Mark left on his trousers. When Margaret re-entered the massage room, Mark was lying prone with the sheet draped across his back and legs. Margaret lowered the sheet and observed a large portion of his back was covered with red circles. The edges of the circles were slightly elevated, and she noticed a slight odor to his skin. Should Margaret continue with the massage? Should Margaret ask the client or his physician about the circles? When should she make an inquiry? Should she consult the physician before, after, or during the massage? So maybe they did this before in a different one, because I thought I read it for the first time. I don't know, or maybe I checked this out before, but I remember doing this before. So what's coming to mind is maybe the chiropractor used silicone cups or some kind of cupping mechanism on the chiropractic patient, and didn't discuss that with the massage therapist, because cupping can leave these red circle-ish marks. And so if the massage therapist doesn't know about cupping, then they need to like go and just ask the chiropractor a question before continuing the massage. There is a red circle thing called ringworm that could happen. So ringworm is what I was told, contagious. So you want to make sure it's not ringworm, and that it's not a rash, and that the rash isn't contagious. So probably refer to the chiropractic real quick. Hey, can you pop in? Hey, I see these rings. Can you please double check? Or did you see them? Confer with the chiropractor, get a second opinion, and then it's fine. Okay. Why is the order of application of techniques important for massage therapy? Give examples. So basically, I was taught in massage school, you need to warm up the tissue or the skin or the muscles a little bit before going in deeper. Um, and so they're like, start with the lengthening strokes, then you can do broadening strokes, and then do like the deep tissue strokes. So like I tried to briefly warm up the tissue, then go in, because if people want their knots thoroughly worked out and they have a lot of problems, like you really need more time to gently work out the knots. And I found that if you gently work out the knots, it seemed like people weren't sore the next day. There were no issues or anything like that. At least that's what people said. And then when I was done working out the knots, then it's like I did those lengthening strokes to like soothe the area. And then that's why I used essential oils also when I did have my own business, because then it would help soothe those achy muscles and help the muscles to relax a little bit more. So, yeah. So, Chapter 9, Infection Control and Emergency Preparedness. So, this is about like, having good hygiene, make sure you wash up to your elbows, make sure your nails are short. If needed, wear gloves, because if you have a cut, or, liquid Band-Aid, okay. Case study. Moxie is a middle-aged African-American female who recently had her second child. While in her early 20s, she began having anxiety attacks with occasional mild seizures. Her physician prescribed medication to control her seizures. While she was pregnant, she discontinued the medication as directed by her obstetrician. Her doctor told her to remain off the medication until she stopped nursing, as the medication is erected in her milk. Many of Moxie's pregnancy-related discomforts are elevated with massage. Her loving husband frequently bought her massage gift certificates to a local therapist, Chantel. Moxie received a massage at least twice a month. She had a standing appointment with Chantel 2 p.m. every other Tuesday. A neighbor cared for Moxie's 2-month-old infant so she could get away and relax. The demands of the new infant, on top of caring for the 2-year-old in the new home, were beginning to take their toll on Moxie. She tried hard to get nourishment her body needed, but it was not easy. Moxie was on time for her 2 o'clock appointment. She entered the massage room and began to prepare herself for the session. She felt unusually tired and thought, timing for this massage is perfect. I really need a break. She pulled the sheet over her and she lay down on her back and closed her eyes. Chantel entered the room and asked Moxie a few health-related questions. Moxie replied in single syllables for about 5 minutes. Chantel asked Moxie to comment on the pressure. Moxie did not answer. Chantel asked again. She looked down at Moxie and saw that her eyes were moving rapidly under her closed lids. Because Chantel had done an in-depth client intake, she knew about Moxie's history of seizures. Not ever seeing one in the past, Chantel assumed that Moxie was experiencing a seizure. Chantel immediately discontinued the massage, anchored her leg to the table side nearest to her, and waited for the seizure to pass. While in school, Chantel was taught to place pillows around the massage table. But doing that meant she had to leave Moxie's side. What if Moxie fell onto the floor while Chantel was gathering pillows? There was only 2 pillows in the massage room. 2 pillows are not enough. Where should they be placed? On the floor? The reality of the situation was very different from what she expected. If you were Chantel, how would you handle the seizure incident once the seizure has passed? How would Chantel explain the incident to Moxie? If you were Moxie, how would you feel coming out of the seizure? If Moxie's seizure had been physical, how might Chantel respond? If Chantel had called emergency services and the ambulance had been dispatched, what would you have happened if Moxie did not want to be treated once they arrived? Okay, the truth is that when I was in massage therapy school, they did not go over this, what to do if your client has a seizure on the table. So thankfully, in my private massage therapy practice, I didn't deal with anyone who had seizures. There might have been one person or two people that said they were taking medication for seizures. And it wasn't a problem. So I was like, okay. So I just massaged them and no one had a seizure on the table. But at my previous job before I was a massage therapist, I was a home health aide. And I was getting ready to go to this one client, or I was getting ready to leave one client's home because I went into people's homes at the time because they needed just assistance in their home. There was this guy on the street. All of a sudden they were walking. I saw the eyeball thing happen where the eyeballs looked like they were seizing, and they had a seizure right there on the street. And then at that time, it seemed like a cop was walking by or some people were walking by. And I was like, what do I do? So I kind of like stayed there in the area for a while. And I was like, okay, what do I do? What am I supposed to do? Am I supposed to call? Like, I don't even think I had a cell phone on me, or I did, or I wasn't sure, but like someone else handled the situation. And I just like saw it. And it's like they were seizing for like maybe a minute, and then it seemed like they came out, the person checked them, and then the person was like, oh yeah, this is normal, this happens all the time. And it seemed like they were gonna get up and just like continue walking down the street like nothing happened at all. So I was just like, I mean, it made me aware that I guess people have seizures, but I was like, this is really weird. Like, how is that normal? And I wondered what the root issue of the seizure was, but no one ever went over that in massage therapy school and made that clear. And the other thing was, it's like, I guess it was like, I kind of did this thing with clients where it's like I let them tell me about their health conditions because they're going to know more about it than me because they have the health condition. And so then I based my treatment of like what I should do for them based on the information they gave me. So if they didn't fully explain their health condition and how the medication worked, then it was like, I'm sorry, I'm not a doctor. I don't know what this frickin' medication name means. Like, and then again, you live in a society where it was like, it seems like everyone was just making up false health conditions, false science. So it was like, okay, well, I need the real medical reason why someone would have a seizure, or their eyes would do like super eye rapid movement. Why would that happen? What is the true scientific reason for that? So like if people are going to pretend to have health conditions and they're going to make a bunch of stuff up, then it's like, okay, you tell me your medical condition and you tell me the solution, and then I'll base my massages based on what you tell me. Okay? Because you want to pretend to have health conditions and not really have them, and you don't want real solutions to health conditions, you know? So that's kind of like where I am, where it's like, give me true science, give me true health. I don't want to hear what you say. I don't want to hear what you think true health is or what you think true science is. I want scientific evidence. I want proof. because you could be making stuff up and you're just wanting me to believe you no matter what. I'm sorry, that's not how true science and true health work. Okay, critical thinking. Why is it important for massage therapists to understand how diseases can be transmitted? Okay, so people told me diseases could be transmitted, but an idea came into my head recently. Well, okay, you could have people curse you to have diseases, or speak negative words over you to have diseases, or true diseases could be, okay, you get a disease by certain foods that you eat, and then you have to figure out the cure or the solution or the blessing that you may have to say in order to heal, but then there would be some kind of benefit to getting that disease. And so people taught me, hey, no one has superpowers. Superpowers don't exist. That's fiction. That's just on TV shows. But hypothetically, what if food can make you sick in a negative environment, and then that food can turn into an extreme blessing where you get a superpower? So you have to experience the negative of how that superpower works in a negative situation so you don't harm anybody. Like, those are the ideas that are going through my head, but I have no proof either way. Okay, so, but that's just an idea going through my head. Why would you get a disease for no reason unless you get some kind of blessing in the end to compensate you for the negative experience that you're going through? Okay, and then because, like, I wouldn't do that. I wouldn't want to get sick for no reason. I wouldn't want to get hurt for no reason at all. I wouldn't want to experience real pain for no reason at all. But if you get a superpower because you experience that pain, that's probably a huge motivating factor to be like, oh, it's just for a short time. It'll be worth it because you get these superpowers in the end, right? So, but again, I don't have any science or personal experience to back up any of these theories right now, but that's what people wanted me to do in the past, was just like, this is true science. This is how it works. This is how health works. This is the solution no matter what, and then you try it out and it didn't work what they said. So, like, I feel like everyone lied to me. I feel like everyone gave me false information and they didn't tell me the truth. And so I'm in emotional pain. I have physical pain. I want blessings to be spoken over me so that I can truly heal. I'm tired of feeling pain in my body and muscle tension and different things. And like, I could care less if I have superpowers or not, but I want the pain to go away and the irritation and the annoyance of how everything doesn't work good in my life. So, moving on to chapter 10, treatment planning, intake and assessment, and documentation. So, these were what the last two videos were about. Filing SOAP notes, getting people's health assessment, getting clearance. Like, if you're working with other healthcare professionals, you might want to have them sign a piece of paper saying we can talk about all the health information with all these different individuals that are on the healthcare team for a certain individual. And it does make sense. Okay. Case study. Okay. Rebecca, 28-year-old Caucasian female, is your next client. She just had her third child and her mother brought her a gift certificate for a 90-minute massage. Rebecca mainly wants to relax. On her intake form, she indicated that about 7 years ago she had surgery on her left knee and no residual effects. You notice the surgical scar is hypertrophic elevated. You read an article recently about the effects of massage on hyperthoracic scars and how it improves their appearance. Rebecca wants to give the scar tissue massage a try today. After placing little shea butter on your fingers, you mobilize the scar and the adjacent area in the deep cross fiber friction. As you massage the area, you focus on Rebecca's face, watching for signs of discomfort. After a few minutes, you glance back at the scar. The scar itself looks paler than it did before the application of pressure, and the surrounding skin is contrast, looks quite reddened. Additionally, the scar looks swollen and more hypertrophic than it did previously. What do you think happened to the scar? How would you explain this tissue reaction to Rebecca? Is this type of massage out of the scope of practice? What should you do next? Okay. Again, this is where they went over pathology stuff, but they didn't really fully explain what to do in every case or certain scenarios. Okay. So there was one client that I had. He had scar tissue in his hip area. I worked on it. The scar tissue never reddened. The scar tissue, like, you could just see, technically I couldn't ever feel the scar tissue. I felt the actual scar because you could see the scar of where the surgery happened. So, he said it was freeing up that area. Again, maybe people were pretending to have scar tissue. I don't know. But I never felt true scar tissue in anyone's body. I felt a fat deposit one time. And I was like, what is this? And they're like, oh, it's just fatty tissue. And it was like a lump in their back. And I was like, okay, that's weird. That feels weird. But they said it didn't hurt or anything. And then, so it's like everyone is different, basically. But like, again, it seemed like the majority of people had the same problems. They complained of shoulder problems. They didn't complain of scar tissue. So I didn't see enough cases where legitimately people had scar tissue from surgery. So, like, I mean, I went by what I felt in the moment. And I was like, I don't even know what scar tissue is really supposed to feel like, because they didn't have a client come in to the massage therapy school and be like, I have scar tissue from this surgery. Okay, and they didn't have, and then it's like the person describes how it feels to them, and then you feel it through their body, because that is literally that's how you would need to assess of like, oh, this is what it feels like when someone has scar tissue or whatever. And then you like have the students take turns briefly working their scar tissue area, right? They didn't do that in massage therapy school. So luckily I didn't have to really do this in my massage therapy business practice, and I didn't have to do this when I worked for 2 different spas. So I got out of this dealing with this issue. When is it important to pay attention to nonverbal cues from a client? Give some examples. Well, an example would be if someone groans on the table. Are they groaning because you're giving them too much pressure? Or are they groaning because it feels so good and that's their natural response on the table of like, oh yeah, or whatever. And you got the pressure just right. So like what I did is if someone groaned, I'm like, is the pressure still okay? And they would clarify. And then if someone was like, oh yeah, that hurts, I'm like, yeah, that hurts, you can still handle it. It's borderline annoying, it's irritating, or it like you don't go any like further as far as deeper pressure. And so it's like it seemed like for the most part people were okay. But in the beginning, when I first opened up my own private practice, I had this client come in. They claimed they had tendonitis in their elbow. I worked the area for a very long time. They said they wanted deep pressure. They psyched me out that the pressure, they needed super, super deep pressure. So I lowered the table. And I did tell them, if it's ever too hard, if it's ever too light, please let me know and I'll adjust the pressure. So they may have said one time, oh yeah, it hurts. And then I continued on with the pressure, and then they didn't say, it hurts again during the massage. So it's like, if it truly, really hurts like crazy, someone's gonna like say something and they would like move their arm and be like, stop working on me, They didn't do that, so they seemed fine. And then I did a follow-up email, or they came back another time and they're like, or something, and they're like, oh yeah, you hurt me way too much. It was too deep. And it's like, I'm sorry, that's not how deep tissue massages work. If you actually feel pain during the massage because someone's giving you too much pressure, you are going to feel in your body that it's too much pressure. And you're going to actually communicate that with your licensed massage therapist. So if you actually didn't feel pain, that's probably why someone didn't tell me that they didn't feel any pain, because they really didn't feel any pain. And someone was coming up with an excuse of why they never wanted to see me again. So they gave me false information. That's probably literally what was going on. So if your client is going to be a jerk, then yeah, they're gonna do this thing of, I want super, super deep pressure, and you give them the pressure that they want, and then they're gonna choose to purposely complain. And then they're gonna make you feel like you're the worst massage therapist in the world. I never want to see you again as a massage therapist. Okay, well, you don't ever have to see me ever again as a licensed massage therapist because you're a jerk for a client. And we did chapter 10, and that is the end of the case studies and critical thinking for chapter 6 through chapter 10. Now, again, massage is a very, what do I want to say, touchy subject for me. I had a lot of negative experiences in the past, and because of it, these negative memories keep popping up. And I wish I had all these wonderful positive experiences where clients came in and I was able to help each client and they felt loved at the same time, and I got paid a fair wage for all my time of working as a massage therapist. But that's not what happened. So I'm telling the truth. I'm being honest about my experiences, and it brings up different memories, different situations, and I'm not giving any of my clients names out because I don't even remember their name because they didn't come frequently enough. We didn't develop a real two-sided relationship with each other where I actually remember who they are. So if I don't remember who they are, obviously they probably don't remember who I am anymore. And like, we never had a mutual, loving, caring, professional, therapeutic relationship with each other. So it is what it is. And again, that's why one day I look forward to when robots are created and design to be programmed to thoroughly work out my own knots, my muscle tension, speak blessings over me, and actually help teach true science and true health and learn that stuff, because like the false science, the false health, it's not fun to experience this, because it's all wrong and nothing works and there are no solutions really to your health. You're just stuck. So I look forward to true health in the future, true science in the future, science and health and solutions that actually work, to be able to make me healthy. I don't know when that day will come, but I look forward to that day. So, again, be careful who you talk to, because someone could tell you a made up fictional thing of here's this disease and here's the solution to this disease, and it might actually not work because there's no scientific evidence or health evidence that that would actually work. So be careful who you trust, because there could be a whole bunch of people just making a bunch of stuff up, and that's where they are. They don't want true science. They don't want true health. So you have to respect their freedom of choice to pretend to have a disease and then pretend that a different solution will actually help that disease when it won't actually help that disease at all. They're in this pretending mode, I guess. I wish someone would have told me that, because then I could have been like, well, go see your pretend doctors, go see your pretend scientists. You don't actually want to see me, because I want real science. I want real health. So, who you see matters. Are you seeing a real doctor with real science and real health, or are you seeing a quack or a fake? The choice is yours. So hope you enjoyed this video. Until next time.